The goal of my research is pretty straightforward. I study back pain and movement to help people suffer less by making jobs safer and rehab better. I'm Ryan Graham, Assistant Professor in the Bachelor of Physical and Health Education program at Nipissing University and the lead researcher in the new Biomechanics and Ergonomics lab. Biomechanics captured my interest because it combines math and physics and applies them to the human body. It touches on engineering and rehabilitation and has applications in places like Nike for building better shoes, in professional sports for helping athletes achieve more and rehab quicker, and in the mining and auto industries for helping workers to avoid injury, to name just a few. In a nutshell, we want to understand how and why back injuries happen, determine ways to prevent them, and improve rehabilitation practices. We look at ways people might be injuring their back. Is it the way they're moving? Is it because they're fatigued or overlifting or not recruiting certain muscles? Can we train someone to move a different way to prevent injury? Ergonomics comes into play as well. We look at different workplaces and tasks and see if there are different ways we can change the job to improve safety. To do this, we primarily examine spinal movements and mechanics. In my lab, my undergraduate and graduate students and I use advanced tools and equipment to measure different types of biological data. We look at how a person is moving using reflective motion capture markers to create a 3D skeletal model of their movement. Force plates in the floor allow us to look at how and where forces are acting on the body, and we measure muscle activity using electrodes attached to either the skin or inserted into the muscles themselves. We use this information to examine spine motion, spine stability, tissue properties, and the compressive and shear forces on the spine to look at what changes we can make to improve safety or avoid injury. We can run different scenarios where a participant lifts an object in different ways and we can see which technique is best from a musculoskeletal perspective. Or we can give someone short-term pain and see how that pain affects the way they move and what other repercussions that might bring. We can also guide medical professionals, like physiotherapists, on the effectiveness of new and changing rehab techniques. We can determine ineffective or poor muscle and movement patterns and help people correct these. Then we can help people prevent back injuries and help injured people recover faster.